Our mission here at Lines for Life is to prevent substance abuse and suicide and promote mental wellness.
I've worked here for 12 years, and I've really seen the climate change as far as the needs for mental health.
For some people, their only access to a trained clinical person is over the phone.
It's actually brave to reach out and ask for help. We need to give our clinicians tools to be able to answer any call, any topic that comes up. So we train on everything from domestic violence to addiction to suicide to aging issues to youth issues. I mean, the whole gamut.
At the end of the day, what keeps people safe is a genuine human connection and feeling seen and understood and heard and cared about. And we make sure that that always stays at the forefront so that whenever they're on the phone or taking a text or a chat encounter, whenever they're talking with somebody in crisis, that person's needs are the only thing that is the priority in that moment.
What stood out to me from the first conversation that I had with Lines for Life was they were talking about enhancing their programs. They already had a very clear training process. They already had a developed quality assurance team. And in discussions with Reflex, it was really about how do we take those programs to the next level. As we spoke to them about training, the opportunity to add more practice and add practice that the trainers did not need to manually lead, but was still high quality, was incredibly exciting for them and exciting for us to be able to be their partner.
The way we've been able to plug in Reflex is really getting people hands-on sooner.
So now we're able to have them practicing in these scenarios with these personas that are very lifelike, they're very realistic.
I was pretty blown away by how realistic it was when I did it myself. All the responses felt like a person responding. It didn't feel like a computer responding.
It's been very enriching and has allowed our incoming folks to have a lot more practice and better practice. And they've really been gaining confidence more quickly in the process.
We were so ready for a new way to get a pulse of how we're doing on calls. We provide quality assurance on our calls, but we really can only do 3% of our calls.
Lines for Life was already thinking heavily about quality assurance. They were already listening in on multiple calls per responder per month. And they had this bigger question of what would the trends be? What would we learn if we could look at 100% of interactions? And the results have just been incredibly positive. What inspires me about this work is crisis lines are the most accessible mental health support in this country. They're free, they're 24/7, and they're focused on providing services and support to anyone who calls in. And as I think about the use of technology and what gets me up in the morning to do this work with crisis line partners like Lines for Life, it's that we can be part of supporting them in their missions to provide 24/7 support to anyone who calls in.
I would never have been excited or even open to the idea of simulated personas taking calls, texts, or chats. That's not what we do here at Lines for Life. However, the simulated personas and texts, they give us the practice that our humans who are going to be taking those calls need. So it's still humans who are connecting with the callers and the texters, and they're still bringing their heart to the work. But the AI has given us tools and practice to be able to figure out what works and what doesn't work on a call.
I feel like we're making a difference in the world in ways that I think are important. So, it feels more like a calling to me than just a job.